So, my lovely family, I understand that I've been away for a while. Yes. It's because I was doing my national service and it was necessary that I stay at the health facility for a long period of time, saving lives. But do not worry, I have come, I'm here, and I'm going nowhere. My name is Antoniette Kenisofori. I'm a youth advocate and a midwife. Welcome to my channel. My channel seeks to educate people on motherhood, pregnancy, sex, family planning, childhood, the pregnancy journey, everything enshrined in my scope of practice as a midwife. If you're a new person, subscribe to my channel, be part of the family, and if you're an old person, you already know how we do it. You have to like it, share, and let's keep saving lives. I am happy to inform my family that there is a solution to infertility, to couples giving birth to children with congenital abnormalities, to teenage pregnancies, to infant and maternal mortality and morbidity. I'm sure you would want to know the solution. The solution is preconception care. What is preconception care all about? Preconception care is the provision of individualized biomedical, behavioral, and social health interventions to women and couples before pregnancy occurs or between consecutive pregnancies to improve on the health status of women, of newborns, and of children born up to 5 years of age. Is this not amazing? Oh yes, it has an aim. The aim of preconception care is to improve on both short and long-term maternal and child health outcomes by reducing behaviors, individual and environmental factors that could contribute to poor maternal and child health outcomes. This is amazing. Before you conceive pregnancy, it is requisite for you to attain preconception care. People who do not receive any preconception care are likely to go through other complications which could have been prevented. Statistically, those who do not receive preconception care, according to key facts and according to WHO, approximately 12 million girls aged between 15 and 19 years and at least 777,000 girls under 15 years give birth each year in developing countries. Out of the estimated 5.6 million abortions that occur each year among adolescents aged 15 to 19 years, 3.9 million are unsafe, contributing to maternal mortality and morbidity. The rate of HIV transmission from mother to child are between 15% and 45% in the absence of intervention. These are all devastating records. Also, iron deficiency anemia increase the risk of maternal death, accounting at least 20% of maternal mortality worldwide. Did you know that in 2018, 25,000 newborns died from tetanus, that is neonatal tetanus, even though 88% reduction from the situation in 2000, with a figure of 200,000. This may sound as a good news, but 100% must be the desired goal. Preconception care can make that difference. Who is eligible for preconception care? Sexually active individuals, couples, and even adolescents. The notion of preconception care aims at targeting existing risk before pregnancy, whereby resources may be used to improve reproductive health of women, men, and couples in order to optimize health and knowledge before conceiving pregnancy. The interventions preconception care employs include birth spacing and prevention of teenage pregnancy, as adolescents are not anatomically matured to deliver babies, leaving them and their children at high risk for death and disability from obstructed labor, fistulas, premature birth, and even low birth weight. At the same time, early childbearing negatively affects the educational and economic opportunities of women, especially women with lower educational attainment, and they have the greater risk of adverse pregnancy outcomes and are even less knowledgeable about health problems or health promotion activities and family planning. Their children as well suffer because they have fewer opportunities for education, for optimal growth and development, and even for higher risk of mortality. Why don't we save these innocent souls from suffering from these health outcomes? They are innocent. They have the right to enjoy life without any complications. Preconception care seeks to reduce maternal and fetal morbidity and mortality. Preconception care prevents teenage pregnancy. Preconception care prevents complications during pregnancy and delivery. Preconception care prevents unintended or unwanted pregnancies. Preconception care prevents congenital abnormalities such as Edwards syndrome. Preconception care prevents neonatal infections such as infections caused by E. coli and even viral infections like toxoplasmosis, rubella, etc. Preconception care prevents vertical transmission of HIV and other sexually transmitted infections. You don't have any excuse or reason not to attain preconception care. Preconception care has interventions being put in place for adolescents. Remember that I said that adolescents are equally eligible for preconception care. So what are the interventions put in place for these adolescents? Every teenager's biggest asset is knowledge. The purpose of education is to acquire the knowledge to understand, the knowledge to observe, the knowledge to reason, and even to make rational judgment about the known realities of the world for optimum survival. Since academic failure and teenage pregnancies are closely interlinked, preconception care emphasizes on the need for teenage girls to complete their basic secondary school education, knowing the risk involved with teenage pregnancy. Preconception care also introduces you to the opportunity for you to understand the importance of condoms as well as long-lasting methods of contraception. And within the introduction, you are being given the chance to make that informed choice depending on any method you would want to use. This is amazing. And to my couples and sexually active individuals, preconception care has also put in place some interventions for you. Within some of the interventions, you would receive reproductive health promotion. It seeks to address birth spacing. Are you wondering why birth spacing? Birth spacing because healthy birth spacing of at least 2 years before the next pregnancy saves women from problems like uterine rupture, third trimester bleeding, preterm labor, low birth weight baby, small for gestational age baby, and even mental health issues like postpartum depression. Advanced maternal aid. Yes, you receive education also on maternal advanced age. Women aged 35 years and older are likely to suffer from complications such as miscarriage, Down syndrome, or other genetic disorders, preeclampsia, etc. This doesn't mean that it's impossible to conceive pregnancy after 35 years. This means that fertility declines rapidly and the chances of complications increases more significantly. after 35 years. That is why, as a woman, it is advisable to conceive whilst you are within your 20s, that is maybe 23, 24, 25 years to 34 years or 35 years. Also, genetic counseling is given during preconception care. Genetic counseling before pregnancy can address concerns about factors that might affect your baby during infancy or your ability to become pregnant. These include genetic conditions in your family or your partner's family, history of infertility, multiple miscarriages or stillbirth, previous pregnancy or child affected by birth defect or genetic condition. So you see the reason why you need to receive preconception care. That history of infertility can be solved without having to go through other strenuous processes and stressing yourself, your finances, the happiness of your home, all to conceive a baby. Receive preconception care, and all these will be solved in a twinkling of an eye. Reproductive planning after abortion is as well being educated or advocated within the reproductive health promotion. Reproductive planning, the freedom for women and couples to choose when, how often, and how many children they wish to have, has a direct impact on health of women and their pregnancy outcomes. So when I see or hear women who have given birth to 9 children, 10 children, and they are still in the process of conceiving another, some way, somehow saddens my heart. Because you have the choice to undertake reproductive planning without having to go through any processes of conceiving too many. When you do that, you are putting your health at risk. The second intervention is your nutritional status. Through preconception care, your diet, your exercises are also being monitored closely. When we take your weight, maternal pre-pregnancy weight, your body mass index is being considered. Do you even know your weight? Do you know as to whether you are obese or not? That weight you are about using to conceive a pregnancy, is it adequate enough to help that of your baby and yourself? Or it is a weight that is going to lead you to complications? That is why you need preconception care. Because body mass index of 30 and higher, that is you are obese, affect normal pregnancy outcome, predisposing women to various pregnancy complications including gestational diabetes, cardiac abnormalities, sleep apnea, giving birth to macrosomic baby, a big baby. And such big babies are not able to come through your vagina. That is the spontaneous vaginal delivery. But do you know what? You would need cesarean section to be able to expel such a baby. And cesarean section also comes with its associated complications. We would go into the complications of cesarean section in our subsequent lessons, but the most common complication associated with C-section is wound infection. You wouldn't want to face that. No. It is terrible. Regarding your diet, with the diet, iron supplementation, folic acid supplementation, and even multivitamin supplementation. So if you are underweight, you are being taken through other diet counseling where you are being given the chance to meet up with dietitians and nutritionists to plan your diet for you. And if you are obesity, then you would have to undergo exercises, whether strenuous exercises or mild ones, to help you lose weight. And you'll be shocked that you'll be able to lose at least 10 kg or 15 kg to be able to conceive that precious baby. Iron supplementation. What does the iron even do for the body? Ions build up extra blood in the body of women planning pregnancy and prevent the risk of anemia Folic acid supplementation. Folic acid reduces the risk for birth defects of your baby's brain and spinal cord, that's anencephaly and spina bifida respectively, and lower the risk of preeclampsia and early labor. And multivitamin supplementation is also being conducted during your diet, your exercise, and your weight loss counseling in order for you to begin your pregnancy with a healthy body, healthy brain, and healthy family, because you're going to be happy, your spouse is going to be happy, you're going to give birth to a happy baby. Another intervention couples and sexually active individuals receive from preconception care is the prevention and treatment of infections. This part is very important to me. Why? Because if you are a woman beginning pregnancy with an infection, if you don't receive preconception care, that infection may or might not be treated, and is going to go a long way to affect this innocent, precious fetus in your womb. So regarding sexually transmitted infections such as gonorrhea, syphilis, candidiasis, etc., if you are being infected, preconception care helps you to get managed or to get treated before you begin your pregnancy journey. Within the sexually transmitted infection prevention and treatment, you are being taken through other HIV/AIDS prevention strategies, even vaccine usage. What is vaccination? Vaccination is simply the inoculation of vaccine into the body to produce immunity to a particular infection or disease. Usually, MMR, simply measles, mumps, rubella vaccine, is being given to women before pregnancy if they haven't been inoculated or if they haven't gained immunity against it. So it is important to receive preconception care. Periodontal disease and dental caries such as gingivitis are as well being examined and treated. Again, under the interventions, you are going to receive screening and management of chronic diseases. This side is also very important to me. Many people are living with chronic diseases they have no idea about, and especially with women who begin pregnancy with a chronic disease whom they have no knowledge about, maybe hereditary, they have no knowledge about it, and they begin pregnancy and it goes a long way to affect them. So when you receive preconception care, chronic diseases like diabetes mellitus, they are being examined. When you are infected or when you are suffering from diabetes, all they do is take you through management and treatment protocols for you to be able to begin your pregnancy safely without having to give birth to a macrosomic baby. Also, the management of phenylketonuria. Phenylketonuria is a birth defect that causes an amino acid called phenylalanine to build up in the body of neonates. Children suffering from phenylketonuria, sadly, you wouldn't want your child to be infected. Also, epilepsy management, thyroid disorders like goiter, hypothyroidism, thyroid cancer, etc. They are all being screened and managed. Within the screening and management of chronic diseases, you get to benefit from other education being given on medication use in case you are being diagnosed of any chronic disease. How you're going to take your medications, you're being taken through that protocol. So you need not to go through any stress having to deliver or conceive your baby. And as well, mental health. Yes, mental health. Your state of mind. You should be in a good mood to conceive pregnancy because you're about to receive a gift, a precious gift from God. So here, you are being given the opportunity to meet psychologists, psychiatrists, to take you through these mental health protocols. There you begin your pregnancy on a sound note. Also, intimate partner violence. This can take a number of forms, including physical, verbal, emotional, economical, and sexual abuse. Also, substance abuse and lifestyle changes. If you're someone who abuses caffeine, you are being taken through education, or you are being given the chance for you to limit it. Through preconception care, we seek to address caffeine intake, alcohol intake, smoking cessation, illicit drugs such as heroin, hallucinogens, marijuana, cocaine, etc. These drug consumptions are being addressed and its management given appropriately, and as well as ameliorating environmental exposures such as chemicals and radiations, because these chemicals and radiations also contribute to some children being born with congenital abnormality. Preconception care is important. Preconception care can make us conceive our pregnancy on a sound note. We need preconception care. Let's save the world. Let's save our beautiful, precious babies. And let's make our families happy. I'll be happy to deliver a healthy baby with no abnormality. And I'm sure you, the mother, you'll be as happy as me to also deliver a baby with no abnormality. You deliver your baby safe and sound, and your family, Ghana, the world as a whole will also be happy to receive your baby. Oh, I'm so happy to inform my lovely family that this is where we will end today's lesson. Preconception care, as I said, is important, and I'm happy you have learned, and I'm happy you are going to share this video for others to also be aware of preconception care and avail themselves for such services. Thank you for watching me. Thank you for subscribing. Thank you for adding more subscribers to my channel. We shall meet again with more interesting, educative topics for discussion. I love you. I love you. Mwah.